Hello, I'm Dr. Petros Grivas. I'm a medical oncologist and professor at the University of Washington and Fred Hutchinson Cancer Center in Seattle. What an exciting ESMO 2023 here in Madrid. Wonderful data, dramatic improvement in overall survival seen in the phase 3 trial with pembrolizumab plus enfortumab vedotin, antibody drug conjugate against Nectin-4. That combination prolonged overall survival compared to platinum-based chemotherapy, GemCis or GemCarbo. And that difference was dramatic, hazard ratio 0.47, favoring enfortumab and pembrolizumab. About a third of the patients, about 30%, received avelumab maintenance in the chemotherapy control arm. The progression-free survival was also impressively longer with pembro and enfortumab combination, hazard ratio 0.45. And overall, I think this is a new standard of care in patients in the frontline setting of metastatic urothelial carcinoma. Toxicity should be looked at in more detail. About two-thirds of the patients had grade 3 or higher treatment-related adverse events, and there needs to be a significant education of the broader oncology community how to dose and modify doses if needed based on toxicity for enfortumab vedotin. Overall, I think this dramatic improvement with almost doubling of the median overall survival is impressive for the patients. Great news. We also saw another practice-changing phase 3 trial in the frontline setting of advanced urothelial carcinoma, Checkmate 901, and this was GemCis Nivo versus GemCis, improvement in overall survival, hazard ratio 0.78. Also, I would say some very interesting durable responses. And overall, this can be the standard of care, GemCis Nivo, in countries where there's no access to pembro EV because of cost in cisplatin eligible patients. And I think there's still room for the Javelin Bladder 100 paradigm, Carbogem followed by avelumab, in countries where there's no access to pembro EV in cisplatin ineligible unfit patients. Overall, the field is moving forward. We saw interesting data from the Thor trial, erdafitinib versus pembrolizumab in selected population based on FGFR3 mutation or fusion in platinum refractory setting. There was no difference in overall survival between the two monotherapies, but there was almost double response rates with erdafitinib versus pembrolizumab. So that may be an option in patients who need a response based on visceral metastasis, symptomatic disease. Overall, very interesting data, impressive data sets across the spectrum of bladder cancer, and we all look forward for the summary. I will do the summary tomorrow, October 24, at ESMO here, covering kidney and bladder, and of course, looking forward for future meetings, and including the ESMO 2024. I will be in Barcelona, September next year. Thank you so much.